From 12 News, this is Newsmakers.
For the second time in 2 months, gunfire in a room filled with young people has left victims dead and wounded, this time at a high school hockey game in Pawtucket. While the specifics of this latest attack are starkly different from December's shooting at Brown, both raise profound questions about how to keep people safe from individuals bent on violence. This week on Newsmakers, we'll discuss potential answers with two leaders in Rhode Island's mental health community. Welcome to Newsmakers. I'm Tim White alongside 12 News politics editor Ted Nesi, and we welcome to the program Laurie-Marie Pisciotta. She's the executive director of the Mental Health Association of Rhode Island, and Prachi Kene. She's a counseling professor at Rhode Island College and also a board member of the Mental Health Association of Rhode Island. Welcome both to the program. Thank you for coming in.
Thank you.
So, as we said at the top of the program there, another shooting, this time in Pawtucket, just on the heels, 2 months away from Brown University. And just briefly, when you on Monday heard about the shooting at the Lynch Arena in Pawtucket, start with you, Laurie-Marie, what was your reaction?
I was deeply saddened. I'm so sorry that this happened to those individuals. I'm so sorry for the people who witnessed it. I'm sorry for the family members of the people's lives that were lost. It's unnecessary and tragic, and they remain in my thoughts.
Prachi, what was your reaction?
Absolutely. My first reaction was that this is a second public shooting that has happened in 2 months, and this contributes to collective trauma that Rhode Islanders have experienced and the impact it is going to have on both adults and children. So I was thinking about how people are going to grieve and cope with the helplessness resulting from the shooting.
Prachi, you obviously, and we want to be very clear, you can't diagnose someone you've never met, but for the average person who hears about these stories, of course their thoughts go to, how could someone do this? And when what we know from public reporting about this individual, a history of violence in the family, there was estrangement, a child who committed a hate crime, a gender dysphoria in this person's past. What does that picture suggest to you from a behavioral health standpoint?
That is a really good question. So first off, I want to say that there are risk factors, and domestic violence has been found to be a risk factor amongst people who engage in mass shootings. But at the same time, I do want to emphasize that there are people who engage in domestic violence, there are people who live with mental illness who are never going to engage in these actions. So mass shootings are really a reflection of a complex and a complicated pathway that is informed by so many different things. We know, like, early childhood experiences, traumatic experiences, systemic issues, and multiple intersecting identities. There are so many factors that are at play here. So we cannot conclusively say that there's one factor or a combination of factors that played a role. I think what stands out to me is that there were multiple pathways, and which highlights to me that there were multiple opportunities to intervene and potentially prevent this from happening. Because most mass shooters, I think the statistic is 93% of them give some warning signs or make elaborate plans. And so do we have systems in place to identify those warning signs? Can
you elaborate on that? Because I think you do, as reporters, you know, these tragedies come to us when we hear the police scanner and we say, oh my gosh, something terrible has happened, or we see it, of course, if it's in another place, come across the news transom. But you know, then you do learn biographical details often about the shooters and find, oh, there was this moment in their life where people saw there was a problem, et cetera. What would intervention look like? Because you do say, could this have been prevented? Could this have been stopped?
Right. So, we cannot predict violence. There is no way. We can make some informed judgments, the likelihood of something happening, but we can never conclusively predict that this is going to happen. What we do see is that there are certain risk factors, like that increases risk for certain people, but then what we look at are some warning signs. So like a medical parallel would be, let's say we look at a group of people who are high risk and they are smoking cigarettes, using alcohol, and they start having chest pain. Like that would be a warning sign. So somebody having sudden shifts in their mood, having like drinking a lot of alcohol or using a lot of substances, engaging in social withdrawal, those would be warning signs. But I want to emphasize also that there are so many people who struggle with mental illness, who struggle with substance use disorders, who are never going to engage in these behaviors. So to answer your question, how do we make sense of this? I think that's the most difficult part. Is it is hard to make sense of this, and it's easy to kind of say that it must be because of factor A, like mental illness, or it must be because of domestic violence. And I think it's really important to not try to say that it is conclusively because of one factor, because there are so many factors that do play a role here.
Laurie-Marie, a few years ago I did a special report on skyrocketing MHI calls to police departments. MHI is mental health incidents in police code, and police departments are folding in training to address it now.
Yes.
And Providence Police, as I reported, partnered with the Providence Center, so they would actually go out on certain calls to try and de-escalate situations. But what was stark to me in that reporting is just the skyrocketing number, the chart I put in that report of MHI calls, and it made me wonder if acute mental health challenges are increasing, or is society getting better at identifying it? Or is it both?
Well, I think during the pandemic, there definitely was a surge of mental illnesses. People were very stressed and socially isolated, and many people had lost their jobs. Families were stressed. It was a really dark time, and we did see an increase in the use of these services. I think things have tapered off a bit, so it's not quite as much of an urgent epidemic as it was. But I think that we might be paying more attention to mental health incidents now. I think it's becoming less stigmatized. I think it's more common to talk about these situations. And I think that having every police officer in the state hopefully will one day be trained in crisis intervention training. And so they will be able to, as you said, instead of taking someone to a jail who's having a mental health crisis, take them instead to a place where they can get the services and support they need. And so we're seeing that happen more and more as more police officers are becoming trained and partnering with social workers to help with these incidents. And now that we have 24/7 988, that increases access.
Can I ask you about 988?
Sure.
This is the crisis hotline that people can call if they're in distress.
Yes.
And I was thinking about after Pawtucket and after Brown, you know, how is the staffing? Are they able to shoulder the increase in demand on 988 right now?
Rhode Island has either the highest or the second highest call answer rate in the country of all the 988s. 988 is an unfunded federal mandate, so every state has to have a 988, and states have to figure out how to fund it on their own now. But they do a wonderful job answering calls. They're so knowledgeable. If someone is in crisis or you just need someone to talk to you need support, you're feeling alone, call 988 24/7, and someone will be there to talk to you and perhaps point you in the right direction where you can get services and support. And I think they're doing an excellent job at handling any increases that we've had. And I think the number of calls to 988 have increased exponentially every year since its inception.
Do you, we have to go to a break in a moment, and it's fine if you don't know, but do you know in the wake of Brown or Pawtucket if there was an increase in calls to 988? Do you have that kind of visibility into that service?
I don't.
Okay.
I don't know. And I don't know if
But
that
professionally, you can imagine probably they do.
Perhaps. Yes, perhaps.
Okay, we're going to take a break on the program. Our conversation continues when we come back. Stay with us. You're watching Newsmakers. Welcome back to Newsmakers. I'm Tim White. This is Ted Nisi. Joining us this week is Laurie-Marie Pisciotta. She's the Executive Director of the Mental Health Association of Rhode Island, and Prachi Kene. She is a counseling professor at Rhode Island College. Prachi, students, athletes, coaches, parents inside the Lynch Arena on Monday witnessed something horrible. And I'm just wondering how trauma manifests in the days, weeks, and months ahead, and what should loved ones be looking for?
So in adults, it might look like having these uninvited memories or thoughts about traumatic events, sleep issues, not being able to concentrate, having thoughts like I cannot trust anyone, I am permanently damaged, trying to steer clear of any situations that remind the person of the traumatic events. In children, especially younger children, may not have the language to articulate what they're struggling with, and so you might see more regressions in their behaviors or new physical symptoms without any medical causes. School refusals. In adolescents, it might be manifested as angry outbursts and substance use. So it really depends on the age group.
And what do you do?
So one thing to do if you are struggling in response to this is to first acknowledge your feelings, to acknowledge what you're experiencing. You cannot just say, just stay positive, just hold on to hope, because what you're feeling is understandable, and it's important that you stay in touch with those feelings. It's also important to stay informed through social media and news, but also to have some boundaries surrounding it, because I think as we're trying to make sense
News
of
people
this,
will agree, by the way. We tell people to watch the news. Truly, like, you know,
Yes.
you can only take so much of it.
Yeah, I mean, there is research that shows that, I mean, when this happens, people are trying to make sense of things, and you want to go on social media and scroll through things, but that can actually increase distress and lead to subsequent increased consumption of social media, which can be really unhelpful. So it's finding a balance between staying informed and also having boundaries. I know this sounds pretty basic, but taking care of your physical health, you can't really take care of other people unless you take care of yourself. Just acknowledging your feelings. If you feel that your symptoms are worsening, is to seek help. And in children, being as honest and direct with them as possible, not making assumptions about their struggles, providing age-appropriate information.
But for example, I have a 3-year-old, and I'm sure they were little ones of that age there cheering on their older siblings at the hockey game. I can't fathom, like, how would I even explain that to my 3-year-old? What just occurred in that room?
Yeah, so you really want to, first of all, not make any assumptions, not project your anxiety onto your 3-year-old. 3-year-olds might not have the language, but they could reenact those events through their play or other activities,
Or
like
art.
paintings and colorings. And it's more about not expecting your child to be brave or like calm, but allowing them to talk about it and letting them kind of create the narrative to express that.
And Laurie-Marie, I want to ask you about another version of some of this, which is you hear after these horrible events sometimes family members or people who are close to the shooter, we feared this would happen. We wondered if something like this could happen. And I don't put any blame on people. They often mean it in retrospectively. They say, oh God, did I see a sign? If someone watching perhaps thinks of someone in their life they worry about, what do? You can't just, I think I can see someone feeling helpless to say, I'm a little worried about this, but obviously I don't want to rush to a court or something and say what should someone do?
You're right. It's such a delicate balance. In my opinion, if you suspect someone you love is struggling with a mental health challenge, I would try to have an open and frank conversation with them. Be very clear and direct, express your concerns, express your observations. Let that person know that you'll support them 100% of the way, and you're there to help them get connected to services if they're willing to go to services. And
what if you're scared of them?
Perhaps a situation of domestic violence. Yeah, that's an even trickier situation. I think that's very challenging, and I think that if you're afraid for your own safety or your children's safety, there are places in Rhode Island where you can find assistance for free. It's confidential, whether it's the Coalition Against Domestic Violence, but these are the experts who have resources to help you navigate that kind of a situation and to make it to safety if you're able to make it to safety.
Anything you'd add to that, Prachi?
Yeah, absolutely. I would say having direct conversations with people, if you feel like you can have conversations with them, having direct conversations with people about guns, about if people have access to guns, and there are regulations in place in Rhode Island where
Red flag law, for instance.
Exactly, where law enforcement can petition someone's guns being removed, and having compassion for the person. I think that's really important. People who live with mental illness live with a lot of shame and stigma, which prevents them from articulating their struggles and seeking help. And I think that the message here is that there is help available.
Well, and that brings me to something I want to ask you, Laurie-Marie. You've been open in your role about your own struggles with mental health. And I know you've said because you think that's important people to hear someone who has gone through it. Can you talk a little to the viewers? We only have a minute or two left, but just briefly about your own story and how you got through it and what your message is to others who might struggle.
Sure, thank you. Behavioral health services saved my life twice, once when I was 17 and once when I was 40. The second time I had been living in agony with a very severe episode of clinical depression, and I think it was at the 18-month mark at that point when I attempted to take my own life. I survived because I had loving and supportive friends, and I had access to the right levels of care at the right time and the right insurance that covered the right amount of time that I needed in those levels of care. That's why I do this work, because not everyone is as lucky as me to have the support system or the health insurance. And I share my story because I want to, number one, reinforce that there's no shame in having a mental health condition or having a suicide attempt. These are painful experiences, and we can come out stronger and more empathic and kinder and wiser from living through these things. And the second thing I'll say is I share my story also because I want those who are in the midst of a struggle to know that they're not alone and that there's hope. There is hope for a better tomorrow. Just keep hanging on.
Laurie-Marie Pisciotta, Prachi Kene, thanks so much for joining us on the program. We really appreciate it.
Thank you.
All right, when we come back, how about some good news for Rhode Island and a tale of two cities? Stay with us. You're watching Newsmakers. Welcome back to Newsmakers. I'm Tim White. A new report by the Rhode Island Public Expenditure Council finds the state has made big gains in fighting chronic absenteeism in schools since the pandemic, but some districts are being left behind. Here now is our special report, Skipping School.
What is the strategy? How do we build this system?
Walking through the brand new Central Falls High School
To bridge that relationship.
Superintendent Stephanie Downey Toledo is eager to talk about a significant turnaround in chronic absenteeism.
Started during the pandemic called Parent Outreach Workers, and those team members have been critical in talking to families and figuring out what are the barriers to getting your kid to school consistently and how can we support you through that.
At the height of the pandemic, nearly half of students in Central Falls were chronically absent from school. That means missing at least 10% of the school year, or about 18 days. Today, that number is down to 1 in 4. Still not great, but a 20-point drop.
Obviously, if we can get it below 15%, even better, but we're pleased that all of our elementaries have hit that threshold already, but the average is really being tugged by both extremes of our early childhood and our high schoolers.
Central Falls isn't alone. A new report from the Rhode Island Public Expenditure Council finds the state as a whole has made major progress, posting the 5th largest decline in chronic absenteeism of any state in the country. Chronic absenteeism soared during the COVID-19 pandemic to 34% in Rhode Island. That since fell consistently to 23% last school year. But the improvement still puts Rhode Island below pre-pandemic levels.
Rhode Island has had a really marked improvement in chronic absenteeism over the last several years, and actually on a national basis.
RIPEC Director of Policy Research Justine Oliva credits the McKee administration's Attendance Matters campaign, which launched in 2023 with public messaging, data tools, and training for educators.
I'd say Rhode Island's also actually been a leader in terms of its use of data. So we have the attendance leaderboard that the state has developed, the attendance nudge tool, basically practical tools for local leaders to use data to effectively get students back in the classroom. We are a leader in that.
But not everyone is keeping pace. Is it a crisis in Woonsocket for you?
It is. It really is.
RIPEC's analysis found Woonsocket has the highest chronic absenteeism rate in the state. More than 2 in 5 students miss at least 10% of the school year. Woonsocket Superintendent Patrick McGee says the lower grades have made gains in recent years, but like in Central Falls, he says the high school is weighing down their citywide absentee rates.
I'm not making excuses. It's just this is sort of the reality that we experience in Woonsocket. It's a very high poverty city. We have many households where our students, especially our older students, are charged with caring for their younger siblings.
But Central Falls and Providence, which both saw improvements, have similar demographics to Woonsocket.
So the question is, why not? Why is it happening here if the demographics are the same? But I can tell you that we reach out, All of our schools have attendance teams.
And McGee is hesitant to say things will get better as Woonsocket is staring down a proposed $850,000 cut in state aid this year.
We're going to continue doing what we're doing, but in terms of adding more onto that with respect to staffing, we won't be able to.
Now, the RIPAC report also raises a concern. Rhode Island is just one of 16 states without a statewide definition of what it means to be present.
There's not a consistent definition of attendance across the state of Rhode Island, and Rhode Island is a minority of states in that respect. Most states require that there is one singular definition of attendance.
In some districts, a student has to be in class for more than half the day to count as present. In others, just walking through the door is enough. The superintendent of Central Falls, where absenteeism rates have dropped significantly in the last 3 years, tells me the state should nail down how districts count attendance.
I think a statewide definition would be very helpful, because then as we're looking at data and measuring students' attendance, we're more consistent and we're actually looking at the same thing.
I worked on that story with Target 12 investigator Eli Sherman. We have the full story on WPRI.com, and you can go district by district, Ted, on what the chronic absenteeism rates are there. And we thank RIPAC for helping us with that report. You know, Ted, you're our politics editor last time I checked. Governor McKee has made education, even before he was governor, the pillar of his public office. Some good news there for his administration. So I imagine that he's going to really lean into this throughout his campaign. He could even make a campaign ad just based on this.
Yeah, when I think of real clear policy wins during the McKee administration, the absenteeism campaign comes right to mind. I mean, they've made real progress. There have been national studies showing Rhode Island doing better on post-pandemic improvements in attendance than other states. Massachusetts started a similar campaign after Rhode Island had. We often talk about when Rhode Island's behind Massachusetts.
We always follow
right,
Mass,
not in this case. At the same time, you know, we don't want to be Pollyanna, and every state is struggling still with how to get learning, how to turn around the problems in this classroom that we saw during the pandemic, and frankly, in states like Rhode Island and Massachusetts, where students were not in less advantaged areas, were not doing as well as you'd hope, considering the massive amount of money that we spend on education in these states. So still a lot of work to be done, but this is, you know, as you said, there's some good news there.
All right. Ted Nesi, thank you so much. We're just about out of time. I want to remind you about our colleague Eli Sherman's show, Behind the Story. This week, he joins Dan McGowan and Kim Kalunian to talk about covering 2 mass shootings in 2 months. I want to thank you for watching. If you missed any of it, it's on WPRI.com. For Ted Nesi, I'm Tim White. We'll see you next week on Newsmakers.